Cognitive behavioral therapy, also known as CBT, has been around since the 1960s. Cognitive behavioral therapy combines cognitive therapy, examining what we think, with behavioral therapy, examining the things we do. Cognitive behavioral therapy approaches revolutionized the prevailing school of thought in counseling and psychology. The first models of cognitive behavioral therapy aimed at gaining behavioral change as a direct result of thought modification. In other words, cognitive behavioral therapy intentions were to treat inner thoughts as if they were behaviors. This significant change in thinking sparked groundbreaking research into cognitive psychology. A new domain of psychotherapy research was formed that began to identify the distinctive types of cognitive disorders and methods to correct them. Today, cognitive therapy approaches often focus on detecting, testing, and changing dysfunctional beliefs, assumptions, and thoughts as the main method of treatment, with the ultimate goal being behavior change. Cognitive behavioral therapy is conceptualized as a collaborative investigation undertaken by the counselor and the client. This collaborative relationship facilitates the exploration of thinking patterns and beliefs that an individual holds that may lead to maladaptive behaviors, erroneous beliefs about oneself and others, and debilitating relationships with the world. Cognitive behavioral therapy, like other therapies, seeks to improve an individual's emotional health while constructing a new, collective, and adaptive behavior. It focuses on the empirical investigation of a person's thinking patterns and cognitive assumptions, which theoretically drives maladaptive, inaccurate thoughts and behaviors. Cognitive behavioral therapy is grounded in theoretical concepts from cognitive psychology, which assert that psychological disorders can be traced to both inappropriate learning and maladaptive thinking. At the basic level, cognitive behavioral therapy views the adaptive processing of information as being crucial to an organism's survival. The theory believes in the importance of learning and environmental influences of personality development, as well as highlighting information processing and cognitive attribution in the development and treatment of psychological disorders. Cognitive behavioral therapy asserts that change is brought about by influencing an individual's cognitive system, which in turn modifies the way that person receives, interprets, and assigns meaning to life. According to the second edition of Counseling Theories and Techniques for Rehabilitation and Mental Health Professionals, in current cognitive theory, all systems work together as modes that consist of networks of cognitive, behavioral, affective, and motivational schemes, which are components of personality and serve to interpret life experiences. Some modes are primal and are tied to survival. However, they can be maladaptive when they are triggered by misinterpretations or react excessively. The development of psychological disorders and conversely the development of positive emotional responses and coping behaviors are assumed to rely on one's evaluations of environmental stimuli, reacting with personal, intimate dispositions along with cognitive vulnerabilities. In cognitive behavioral therapy, the counselors work with the clients to override these primal modes by replacing them with purposeful thinking, intentional goals, problem solving, and long-term planning. So what are these techniques and exactly how many of them are there? Cognitive behavioral therapists use a wide variety of cognitive and behavioral strategies, such as emotional behavior therapy and the social learning theory. And these are just to name a couple. This gives counselors literally hundreds of intervention techniques to choose from. However, counselors try to be particular when choosing from the abundant techniques available. They mostly use evidence-based practice when carefully examining the utility and efficacy of a technique for a patient. Despite individual differences in technique and treatment needs, all cognitive behavioral therapy approaches are based on a set of general principles that can be applied to most clients. Those principles are unique cognitive conceptualization of each patient, a strong therapeutic alliance, goal-oriented therapy, initial focus of therapy is on the present time, therapy is time-sensitive, therapy sessions are structured with active participation, clients are taught to identify and respond to dysfunctional thoughts, and therapy emphasizes psychoeducation and relapse prevention. These treatment principles provide a solid foundation that therapists can cope with specific cognitive behavioral strategies and techniques. Therapists start by helping clients to find patterns expressed in their automatic, fleeting, and persistent thoughts in order to identify underlying dysfunctional core beliefs about themselves, the world, and others around them. Such thoughts as, I am stupid, or I am worth nothing. Therapists then work to identify these unwanted behavioral patterns that clients use to cope with these thoughts, such as avoiding social situations and possible drug use. From the beginning of therapy, cognitive behavioral therapists always work to develop a positive, respectful, collaborative, and strong therapeutic relationship with their clients. This helps to ensure that clients are trusting and open with the therapist. Upon the first session, the counselor will use cognitive behavioral therapy and devise specific and realistic goals by using open-ended questions, such as, what would you like to work on by the end of therapy? In addition, therapists will encourage the development of short-term goals and assess the client's degree of motivation towards this change. Cognitive behavioral therapists assume that individuals have control over their own thoughts and actions, permitting clients to be active agents in their own lives. In the beginning, this goal-oriented therapy should focus on current issues in the client's life, so the client can stay focused on the problem at hand. The treatment duration for cognitive behavioral therapy is time-sensitive, as it aims to affect change very rapidly. Yet, its time frame can vary depending on clients' needs and how well they progress. Therapists regularly request feedback from their clients to observe their understanding of the treatment and the methods used, as well as to inherit interest in session content. With receiving honest feedback, therapists can modify strategies and techniques based on the client's individual capabilities and preferences. In addition, therapeutic homework assignments are regularly used and considered a great component of cognitive behavioral therapy. But the homework is customized to the client to enhance the relevance and likelihood that they'll complete the therapy. While each client has his or her own needs, meaning each session or client needs a different amount of time to address their needs, according to Simon and Singelman, treatment termination can usually occur between 4 and 14 sessions, depending on how well the client is dealing with straightforward problems. While I'm sure there are to be many advances in the years to come, cognitive behavioral therapy has proven itself to be a very effective form of therapy in today's world.